Hello, happy Tuesday. I'm popping on today because there's a really important thing happening next week for a lot of patient advocates, and I wanted to talk about that. Most of you know, if you're on this channel, that the way that I kind of got my start is by being a patient advocate. I've been in the patient advocacy world for like 45 eons at this point. It feels like forever, since about 2006 when I was first diagnosed with MS. And at that time, I started blogging, and that was back, in the prehistoric days when blogs weren't really a thing and nobody paid attention to them, and you were just talking to yourself a lot on the internet, kind of like right now. And so that's kind of how I started. And from there, I got more opportunities, and people asked me to blog for them, and they asked me to do interviews. And then it turned into speaking engagements, and then it was jobs, and now it's consulting and all these other things. And I got here because I worked really hard on elevating my online presence. And what I have done with that is turned that sort of into a career, something that I help other people do. And the reason why this is really important this week specifically for patients, why this is important, is because next week is the Healthy Voices Conference. And the Healthy Voices Conference is a conference designed by patients, for patients, just for patients, only patient things. And that is so cool because that doesn't happen enough in healthcare. Patients are sort of an afterthought at a lot of conferences, and there's a shift to get more patients to go to these conferences, but nobody can afford them. Nobody can afford to get there. So this is a really unique thing. And when you go there, you're surrounded by all these different patients and all these different health conditions. And it's like this huge family that you never knew that you had, or this huge family that you feel very comfortable with. It's a really, really awesome experience. And the patients that get there, I'm not going to say all of them, but I will say a lot of the patients that got there did so by creating an online presence, so that way they could be found. When somebody Googles inflammatory bowel disease, maybe my name comes up. When somebody Googles HIV, maybe some of these patients' names come up, and so on and so forth. So I wanted to talk about, the top 5 reasons that I think as a patient advocate specifically, that you should really be working on your online presence and how to elevate it. First and foremost, I want to say that being a patient advocate in this realm of conferences and helping other patients, I'm not talking about this as a career. Turning this into a career is really, really hard, and it's not very lucrative, and it'll be a whole lot of work, and you're going to run yourself into the ground. It's doable. People do it, but that's not what I'm talking about right now. I'm talking about as the average patient advocate, as you, as me, as anybody who's newly diagnosed and they want to make a difference. This is why they should be putting an effort into their online presence. First and foremost, awareness. Like, duh. People go to the internet when they're looking for information. You probably went to the internet when you got your diagnosis, or somebody in your family got their diagnosis. These are all the reasons to put your story out there, to raise awareness for your condition. If you have a rare condition, that's another voice that people need to hear. All of these reasons, raising awareness turns into fundraising dollars eventually. Whether we like to admit it or not, the more awareness you have, the more attention people are paying, the more money that ends up coming your way. So awareness is very, very much the number one reason to elevate your online presence, to help tell your story, to bring more attention to it, to raise more money, to do whatever they're going to do money with. The second reason is to educate. And sometimes awareness and education go hand in hand, but I think that they're different. So awareness to me is like, hey, this exists in the world, and people have it. So maybe pay attention, or like do a Google search one day. Educate is different, because I think that there are so many patients in this world, and so many families, and so many people that are affected by various conditions. They don't know about them. And maybe they try, maybe they Google and they Dr. Google and things, but they don't really know about them. And so there has been this huge shift in, I would say, the last 10 years among patients to really educate each other in ways that doctors are just unable to do. Doctors are lovely, most of them, but education about what your life is really like, or what you can expect, or what it's going to be like, especially after procedures or medications, patients are really the gold mine for that. And so I started sharing my story because, really, I just needed to verbal vomit what was happening in my life. But what I learned was that I could teach a lot of people what to expect, and I could do it in a really honest way that maybe it was scary at times, but they knew I was never leaving anything out. They knew exactly what they were going to get, how they could deal with it. And by watching me deal with it, it taught them ways that they could deal with it. So number 2, for sure, education all day, to each other, to your friends, to your family. If you are newly dating somebody and you want them to learn about your education, you can send them to somebody else's blog and teach them everything they need to know without doing it one-on-one if that's uncomfortable. Number 3, helping other people. Again, awareness, education, they all kind of work together, but helping other people is this thing that I didn't know that I was doing when I first started blogging. I thought nobody was reading this because why would other people read about this? But they were reading it, and they were commenting, and they were sending me emails about how helpful what I was doing was, and how they didn't feel alone, and how it gave them hope, and all of these things that eventually turned into me starting a nonprofit because of all of those helping other people things. So when you elevate your online presence, you share your story, and that story, you just telling that story, you being honest, you telling the world what it's like, helps other people. It helps a lot of other people. People you may never meet, they may never reach out. There's a lot of lurkers out there who don't comment, who don't like, but they're reading it. And you can read all the data, and you can get your stats and your analytics and stuff to, like, if you really want to feel good about it. But just know that your story really helps. And there are families out there that will be changed by your story. You will be helping people on a level that no doctor can ever help them. And that's a pretty cool thing as a patient. Number 4, your story matters. And also you can use your story as a really cool way to meet other people, and really important people. So when you share your story online, people find it, and you can meet other patients. A lot of my best friends in this world are other patients. You create these connections, these family-like, strong, deep connections with other patients when you meet them through sharing your stories. And then the other really cool thing that happens is when you share your story online, you get to meet important people. And by important people, I mean decision makers. So there's this shift in healthcare now where they're starting to ask patients what we think and what we feel and what our experiences are. And these decision makers in pharma or in healthcare or in even corporate world are starting to realize that we have a lot of valuable information and a lot of life experience that could be really valuable. So when Joe Schmo from whatever corporation in HR needs to learn something about something that you know about, if they Google it, they see that you're telling people what it's like, they might reach out to you to help them craft a program or create a talk or a workshop or something. When you share your story online and you work hard to become a credible patient and a respected patient, you meet a lot of important people. Arguably, number 1, those important people are other patients. Number 2 are these sort of decision makers, as I will call them. And that's kind of a cool thing that legitimizes what you're doing, in my opinion. When I had decision makers reaching out to me, asking my opinions on things, that's what made me feel like what I was doing was super legitimate, even though I already knew what I was doing because I was helping other patients. Number 5. Number 5, honestly, a little bit of money and some opportunities. So like I said, money it's there, but it's hard to make a living on this. So, but what you will get is opportunities. And these days, a lot of those opportunities might be paid. You could become a keynote speaker. You could sit on a panel. You could teach a room full of corporate executives how to interact with people with chronic illness. I have friends who have done all of these things. They've sat on panels. They are a part of pharma advisory boards. They are doing all of these things. And I've had a lot of really, really cool experiences, like Healthy Voices, like being a keynote speaker, sitting on panels, sitting on advisory boards. Right now, I'm currently a member of a global advisory board about clinical trials, which is really cool. And all of that is there because I decided to start blogging a million years ago and telling people what I knew. And so now there's no way to say this without sounding kind of cocky, but in my community, in the patient community, I like to think that I am somebody who is known. That sounds weird, but you know, other patients know who I am. People in industry may have heard of me. I am somebody who is respected in this community, I think. I know. And that is because of the work that I have put in online. So these are really top 5 things: education, awareness, help people, telling your story, meeting people, and some opportunities. So how do you do all of this? There's a lot of ways that you can do that. And that's one of the things that like I work with clients to do. Most of them are not patients now, but it all is the same thing. It translates, you know, the way that you build your stuff organically, or if you've got the cash, make ads. These are all things that you can do that elevate your voice, that make what you're doing important. I mean, what you're doing is important anyway, but I mean, the more people who have eyes on it, the bigger it gets, the more that it's kind of less about you and more about like what it's offering to the world, which is a really, really great thing. So if you're going to Healthy Voices next week, I will see you there. I'm super excited. And if you're not, and maybe you want to get there next year, start now. You have a full year to start working on elevating that presence and working towards becoming a credible patient, becoming a credible resource for other patients and for industry. So, you know, use those 5 things. Find ways that it's not about just blogging or just tweeting or just being amazing on Instagram. This is about elevating yourself online, your whole presence as a patient in this space. And so that's something that I think it's completely changed my life. My life would not be where it is right now had I not done that so many years ago. So if you're just starting out, you can still get there. There's lots of time. This stuff is not going away anytime soon. So next year, Healthy Voices, it's always around this time of year. And if you want to be a part of it, their applications open in January, February, somewhere in there. But spend the next year learning how other patients do this, how they elevate their online presence. And you can, they are live streaming Healthy Voices this year. So if you're not going or you're new, all of these things, you can watch it online and learn all of the same things. So that's all that I have for today. Have a lovely week and see you guys next week, some of you.